This is News Channel 5, Today in St. Louis.
There's still more ahead on Today in St. Louis at 6. Coming up next, a local doctor will tell you what you need to know to make sure your child is ready for contact lenses. Stay with us. Is your child anxious to ditch his or her glasses for a pair of cool contact lenses? Well, today's lenses are far more comfortable and safer than contacts of even a decade ago. Wearing contacts still requires diligent care to avoid eye infections and inflammation. Joining us this morning is Dr. Jim Wachter, Clinical Director of Clarkson Eye Care. Doctor, thanks for joining us.
Thank you.
What are the guidelines when you have a child that wants to wear contact lenses? What are some of the things you need to consider?
Well, first of all, the child has to want contact lenses. And if the child wants contact lenses, mom and dad want contact lenses, generally that's a recipe for success. Things we look for is, with the parents' help, does the child take care of personal hygiene? Do they brush their teeth without being told at night? Do they show some personal responsibilities, some independence, clean their room, things of that nature? And that's where mom and dad come into play.
Is there an age limit? Is there a 6, 7, 8, or does it just depend on the child?
Depends on the child. I've got kids that are 6, 7, and 8 that wear contacts and do great. I've got kids that are 12 and 13, frankly, that aren't quite ready. And again, that's where mom and dad come in and help make that decision for us.
You have more kids nowadays wearing contact lenses than, say, 5, 10 years ago?
Yeah, absolutely. I think with more kids playing sports, I think kids want to wear contact lenses, and they obviously are beneficial when you're playing athletics. Kids sometimes just don't like to wear glasses, and so we are seeing kids at a younger age get into contact lenses.
You said the big concern with kids in contact lenses is proper care and maintenance, and you bought some props along. Talk about what this is.
Well, recent years past, we kind of got away from the rubbing of the contact lens, and we got more into, how quickly can we clean our lenses and stopped rubbing them. But what we found was an increase in infection, an increase in red eyes and things of that nature. And so we're kind of getting back to the easy rub and rub and rinse mentality, and it's worked very well. We've seen a decrease in infections. One of the things you'll do, briefly to show, obviously a larger contact lens, but when the lens comes out of the eye, obviously wash your hands. That's the first step. Put a little solution in the palm of your hand and then some solution, some drops in the lens as well. And we're going to rub from the inside out. Rubbing in circular motion often results in the lens tearing. So we'll rub inside out, flip the lens over, put a few more drops in, and we'll do the same on this side. Then the lens will be rinsed with the solution on both sides. The case will be full. Put the lens into the case, and then disinfect for 6 to 8 hours overnight. One last point there, too, is in the morning, take the lens out, rinse the lens both sides, dump the solution out, let it air dry after you rinse the case. But one thing I want to stress, too, is don't top off your solutions. A lot of folks will try and reuse and save solution. That's a recipe for infections as well.
And sometimes kids surprise us with their intelligence. And I imagine once you teach them how to do this and maybe work with them for several days, they get it.
Right. And at this point, remember, it is a medical device. The contact lenses and the solutions are medical devices, so we've got to treat them with such respect.
Any concerns about children losing contact lenses? Because I know they can be expensive and kids have a tendency to lose things. So any tips on how they can keep track of their lenses?
Yeah, I mean, it's always a problem, but with the advent of the disposable lenses, it's not quite as big a financial loss when you lose a contact like it was 15, 20 years ago. So, just be patient, be slow, take your time, and most kids do pretty well.
Okay. Dr. Jim Wachter with Clarkson Eye Care. Thanks for joining us this morning.
My pleasure.
Stay with us. We'll be right back.